All right, just had a professional ask me this question about resting metabolic rates. When should someone be doing a resting metabolic rate, and why is it even important besides doing the calculators online? There's a couple reasons why we would want to do a resting metabolic rate. One, the individual has been taking some form of medication, supplement, compound, peptide, steroids, all those type of categories that change your morphology after a while. It's not going to be the same as using a calculator online. Those things change your metabolism for the good, for the better. From all the times that I've seen, usually the uppers will increase your metabolism versus the downers will decrease your metabolism. That would be one of the reasons why you would really want to get a deep dive test with a actual professional machine as to opposed to a calculator, because it's not going to equate pound per pound what that equation uses online. Another reason would be significant weight change. So whether you gained a ton of muscle mass in X amount of period, or you lost a ton of muscle mass and fat and weight in a certain amount of period. Those are the main reasons I would take a resting metabolic rate test. I'm trying to keep this as quick as I can. The other things would be, let's say someone's overtraining and they show signs and symptoms of overtraining, but you're not sure. Well, I could tell you the test using the respiratory exchange ratio or the respiratory exchange quotient, which some professionals use, either or, same thing. I could tell you if you're overtraining. I could tell you if you're also adapting to certain diets. So if people are doing this carnivore, keto, high protein diet and they're trying to get that ketosis, I could tell you whether it's working or not, because 100% of the time, sorry, let me rephrase that. Most of the percent of the time, people are not doing these diets correctly for the adequate adaptations they're looking for. I could tell you if you have an actual chance of having diabetes, whether you're type 1, type 2. I could tell you on the machine just based on the RER and the REQ. Those would be the reasons why I would do a resting metabolic rate. Anybody that's taking any supplement, medication, or anything like that, or you're trying to see something change within expedited rates, you could do them every 3 months. Normal, healthy people that are just generally going through a weight loss or weight gain phase, twice a year, every 6 months if you want to get the data. But if you're generally healthy, you could use those calculators online. I'll give you a rough estimate of what you should be consuming. So that is my thoughts on resting metabolic rate testing and when to do it, because it is a costly test, anywhere between $100 to $250, even $350, depending who's doing it, what machine, what processes, what else do they offer. That's pretty much why I would recommend doing a resting metabolic rate. And that's pretty much it, guys. I'll see you for the next one. Oh, and you asked, yeah, that's a DEXA scan. Been doing it for over almost decade now, using these machines. So, yeah. Talk to you later.